Hello everyone. In this video, we are going to learn about Aushadh Sevan Kaal. It means the timing of drug administration. As you know, however potent the medicine is, but if it is consumed at an inappropriate time or the wrong time, it won't be beneficial for our body. Therefore, understanding when to consume which medicine is extremely important. In Ayurveda, Aushadh Sevan Kaal is explained by Ashtanga in Sutrasthan 13th chapter as well as by Charak in Charak Samhita. Why is about why the timing matters. It affects absorption or the avastha of the Agni. As you know, Agni plays a major role in digesting everything, that is, the food as well as the medicine. If we prescribe a medicine at a time where the Agni is weak or manda, it will lead to lesser absorption of the medicine, which hence will not show the appropriate results or effects which we expect in that particular disease. It also has a direct action on the dosha. As you know, every segment of the day is related to one or the other dosha. If we have to prescribe a medicine for Pitta dosha, we have to correlate it with the timing allotted to the Pitta dosh, which will help you increase the potency as well as the efficacy of the drug. It improves the therapeutic outcome. As I said earlier, the timing when the medicine is prescribed is highly related to the outcome. If you prescribe the medicine at the right time, it will definitely show you better results. Now we will see the factors deciding the timing. The first is the Vyadhi. Now, as you know, each Vyadhi is comprising of a single dosha or a combination of multiple dosha. The amount of dosha is disturbed is not going to be same for all Vyadhi. Agree? Hence, you cannot prescribe a single medicine or multiple medicines at the same time because it will not work on that particular dosha because every dosha has a different timing. Second is dosha predominance. As I have mentioned earlier, it is the same thing. As the doshas are different, the combinations are different. Every drug is going to act at different timings related to that particular dosha. Third is Agni and Bal. You cannot prescribe a highly potent or a medicine which is difficult to digest. You cannot prescribe that when the Agni is low or when the Agni is Manda because Manda Agni will not have that much amount of power to digest the heavy medicine, which will indeed lead to lesser absorption and hence it will not show the results which you expect. Fourth is a food timing. If you want to prescribe a medicine for a panvayu vikruti, you cannot prescribe it after taking food because a panvayu is at the base of the digestive system. This is just a hypothetical thing, making it easier for you to get the concept. Okay, so a panvayu is like the lowest because it does the karya of mala visarjan, mutra visarjan, vayu visarjan, right? So if you want the drug to act on the apan vayu, you have to prescribe it before consuming the food, right? So food timing plays a crucial role. Now we will see Aushadh Sevan Kal Prakar as mentioned by Varpat in Ashtanga Sutrasthana Adhyay Kramanka 13. First is Anannakal, that is empty stomach. It is going to show you the strongest action because there will be no food in your stomach. As your stomach is empty, there will be no interference or hindrance in the absorption of the medicine. The medicine will be quickly absorbed. It will going to show you better results. Second is no food barrier, right? Absorption will be higher. Now, best for kapha and rasayan. Now, kapha is predominantly higher in Pratarkal, that is in the morning. So the morning period, early morning is best for kapha because kapha dosh is predominant in that period. So if you want to prescribe a medicine for kapha dosha, annanakal, empty stomach, that is in early morning, is the best time for you. Rasayana is rejuvenation. Rejuvenation will only occur when the gut is clear, when the gut is empty, and the medicine is absorbed fast. So Ananakal is best for kapha and rasayana. Then Lekhan Dravya, that is the one which is used for obesity or for scraping the toxins or the maida, will also be prescribed in Ananakal. For example, if you have Atyanta Kadu, that is extremely bitter, or the one with bad smell or bad odor, these medicines can also be used before consuming food, because obviously if you consume it later or post meal, then you may tend to vomit. Okay, so it's better if you consume those medicines in an empty stomach. Okay, second is Prag Bhukta. Okay, this is Bhukta. Okay, Prag Bhukta, that is before meals. Prak means before and Bhukta means meals, so it means before meals. So as I mentioned earlier, it is going to act on your Apan Vayu. Okay, if you want to prescribe a medicine for Apan Vayu, okay, or in the region where the Apan Vayu is predominant, that is in the lower intestines, the large intestines, then you should give the medicine before consuming food. Or else what you can do is you just have the medicine and then immediately you have to have food. Or else there will be no difference between Ananakal and Pragbhukta, right? Pragbhukta is just before meal. When you have a digestive issue, or else when you have what you can say is anorexia, or you have mandagani. So when you want to ignite the digestive fire, you have to prescribe the medicine before meal, okay, because it is going to stimulate your agni, which will be helpful in improving your digestion. All right, so again you have to be very careful while prescribing the medicines, because these medicines are going to be ushna as well as tikshna, so be careful. You have to consume meals immediately after consuming the medicine. Next is Adho Bhukta, that is Adho means later and Bhukta means meals, which means after meals. After meals, जेवणानंतर लगेच औषध घेणे, right? You have to consume your meal immediately after consuming food. This is going to target your Vyanavayu and Udanavayu. Okay? Udanavayu, if you want to target Udanavayu at night, post meals, and if you want to target Vyanavayu, you have to give them medicine in afternoon post meals. Okay, remember for Udanavayu post night, that is post dinner, and for Vyanavayu post lunch. Okay, you have to consume those medicines. In this time, the kapha is going to be increased. Therefore, all the Kaphahara medicines are prescribed in this Adobhukta Kaal. Also, when you're prescribing Asava and Arishta, which are highly Ushna and Tikshna, you have to prescribe it post lunch, because the food which is present in your gut will suppress the Ushnata and Tikshnata, that is the high potency of the medicine. It will just lower its Tikshnata or penetrativeness, which will be better for your gut and mucosa of your stomach. Okay, it is useful for upper body disorders because Vyana and Udanavayu are related to it. Okay, in this you have to prescribe the medicine after meals when your patient is having aruchi, that is not liking the taste. Also, if you have the medicines which are bad in smell, do not prescribe it in after this period, that is of Adobhukta, because post means you may feel nauseatic or you may vomit. Okay. Next is Madhya Bhukta. Madhya Bhukta, Madhya means in the middle, Bhukta means meal. So Madhya Bhukta means mid meal. It balances your Saman Vayu and it improves your digestion. Okay, as you are going to consume it when you are having your meal, okay, half of your stomach is full. Then when you consume the medicine, then few some part of your stomach is going to get full, right? Then the medicine will get mixed with the food and then the digestion will become easier. When you have Agni Mandya, the diseases which are related to Mandagni, that is Grahani, Ajirna, Adman, or Antarkosan. Grahani is basically irritable bowel syndrome, Ajirna is digestion, Adman is bloating. Okay. Uh, when you have these conditions, you are advised to prescribe the medicine mid-meal. Also, when you have Pitta Pradhan Vyadhi, okay, so Pitta Pradhan Vyadhi, you have to prescribe the medicine Madhya Bhukta, that is in mid-meal. Next is Antar Bhukta. Antar means between and Bhukta means meal. So Antar Bhukta means between meals. It is to be given during the digestion phase, that is when the process of digestion is going on. As the process is going on, it is going to be helpful and it is going to be related with the digestive issues and it is going to have a better systemic absorption. In Antargupta, medicine is given if you want to target the Vyanavayu. When you give the medicine between the meals, the surface area for absorption increases as the medicine gets stick to the intestine or the gut and it spreads out in the whole area of the intestine along with the food, increasing the absorption. Next is Sabukta. Sa means along with and Bhukta means food. So Sabukta means with food. The medicine is given mixed with diet. We usually prefer this in children, or if the person is not willing to consume medicine, or if the person dislikes the medicine, it is mixed with the diet or mixed with the food and given. It is obviously going to have a mild action as the potency decreases because the food gets interfere with the absorption of medicine. It is good for weak patients, as in if a patient is not having enough capacity to absorb the medicine, then or then Sabukta, that is with the medicine is given with food. When a patient dislikes the medicine, you can give it in the form of food. For example, when you have to give snuhi arka or snuhi, you can mix it with chapati or bhakri. Okay, when a patient is having amvat, the erenda tel or erenda sneha is just applied to the chapati and given it to the patient so that the patient won't be able to identify the medicine. It will be easily consumed by him or her. Okay. Also, if you want to decrease the armor for armor pattern, you can provide sunthi and adrak swaras or adrak sunthi churna along with food preparation. In Sandigatwat, you can consume kulit. Okay, kulit yush, that is a paste which we make, kulit khichdi, okay, during the food. All these are the examples for you through which you can consume the medicine along with your food. Next is Samudga. So what do you mean by Samudga? It means before as well as after meal. So prescribing medicines before meal as well as after meal. Okay, this is basically for igniting your digestive fire and also for digestion. That is a deepen and pachan karnarichi ke dravya hai. Okay, it is a strong deepen pachan. The drugs which are used for igniting as well as for increasing the digestion are given before and after meals. It prominently helps in saving or preserving your agni. Next is सहग्रासा. सहग्रासा is with every morsel of food. आपण बोलतो की प्रत्येक घासासोबत घ्यायचं. ओके, हर अन्य के निवाले के साथ लेना है, उसे स्वग्रास कहते हैं. It is to continuous stimulation. Okay, you just have a bite of food, medicine also enters it. Okay, action starts occurring. Again, you consume a morsel of food mixed with medicine. Again, the gut is stimulated. So, for continuous stimulation, Sawagrasa is used. This is also for Deepan Pachan, that is for igniting the digestive fire as well as for increasing the digestion. Next is grasantara, that is in between the bite. So you take one bite of food, then you take one bite of medicine. Okay, food, medicine alternatively. Okay, is grasantara. It enhances your taste as well as enhances your appetite. So in patients having anorexia, that is aruchi, you can consume the medicine in between the bites. So एक घास घ्यायचा, नंतर औषध घ्यायचं, मग पुन्हा एक घास आणि पुन्हा औषध. Like that, you have to follow that through. Okay. It is important for increasing the taste as well as the what you can say appetite. Next is muhur muhur. Muhur muhur means repetitive dosing. Frequent consumption of medicine is known as muhur muhur. This is like you have to consume it in a small quantity after frequent intervals. Okay, basically, if you have patient is having cough, cold, or hiccups, in that case, it is hikka, kas, shwas, hikka. The medicine is prescribed in muhur muhur sevankal, that is in repetitive dosing. Okay, if your vyadhi is situated in some marma or it is very deeply situated, it is spreading quickly, you can give this muhur muhur. Hemagandha, Suvarna Suchekar, Samir Panna Garas, all this is given Gurmu, that is in repetitive doses in smaller quantity. In Tamak Shwas, Narayan tail is used. Uh, it is consumed one spoon frequently along with warm water. Okay, it decreases your shwasa and it is going to maintain the drug level and hence decreases the disease. Next is Nishakal. Nishakal is night administration, that is a medicine to be given at night time. It acts during the rest, like when you sleep, still the peristalsis process is going on. The medicine will act and continue its absorption through gut. It is best for Vata disorders. Okay. Next, the clinical summary. On an empty stomach, the medicine will be absorbed the strongest. Before meals, it will going to affect your digestion. After meals, if you have an upper body related issue, and frequent dosing for acute conditions. I hope you understood this Aushadh Sevan Kaal.